going even a step further on that example, and we can stay here, but just to close that one up, we did a test and learn on that one, and while the visualization of the letter I was showing on that slide had an overall higher yield, what we found was within particular pockets of the Medicare population, some liked the control group. And so there was this aha moment of not everyone wants to just see kind of the latest, flashbang kind of design and colors and Johnson box and QR code. Some populations actually value a more sort of like stoic and sober message there. So what you learn out of it is not that, look, this one's good, this one's bad. What you learn is we now have rules that we can administer in whatever our communications platform is to say this kind of group gravitated towards this kind of letter and this gravitated towards that one. Now you're starting to get into that personalization in a really practical way without having to introduce, AI bots all over the place. Um, Last one on this, I just want to touch on this because I think, Melissa, you mentioned earlier, there are certain materials that they have to go out just more from a compliance perspective. And one of the most exciting and I think creative is with the explanation of benefits documents. So, for example, your platform vendor, whomever you're working on for your print correspondence or your EOB distribution, you're sending them a lot of information. I mean, you're sending the zip code and where that person lives. I mean, all those things that are requisite to just get communication to that person. But native to the EOB document, you also have insight into what a recent care episode looked like for that member. And that is a fascinating opportunity to just scratch that surface a little bit deeper. This is looking at, just a blinded 6 month worth of volume data for a regional health plan that we support. And we said, we've just been sending these EOBs out with complete generic type of language around them. And it's basically that actuarial table, which needs to be there, no change to that, but then no other context really. Now, this recency and relevance is a huge opportunity with a member, especially if you've got something like a care gap closure or a cost improvement opportunity. With just a little bit of data analysis, we found, hey, in the last 6 months, about 45,000 people just looking at hemoglobin A1C tests, and so our diabetes or pre-diabetic population, and then about 10,000 that went to the emergency department when they really didn't have to. We had a really low medical diagnosis need, no physician required. All of that data is just sitting there. And what we started to do is say, why don't we promote the diabetes prevention or management program to these 33,000 people? And this is just on an address sheet. This doesn't change anything about the compliance of the document. And for others, maybe they're not as aware that there is an urgent care network out there that they can utilize. So, talk about your low-hanging fruit of this person with their healthcare actions just told us that this was relevant to them. And we now can do the connection between there's something in their benefits plan that they can take immediate action on. So really, really nice opportunity to look at those EOB documents that you're distributing and challenge if you're connecting those dots as effectively as you can here. One other thing that I know is on everyone's radar, just almost ingrained in our everyday lexicon since the pandemic, is the usage of QR codes. And we've seen a really kind of validating data set that says, regardless if we're talking to Medicaid, commercial Medicare, duals, et cetera, there's a huge benefit in terms of convenience to presenting things this way to members in terms of how we ask them to take that action. It's showing to just be simpler than the phone call, and it's showing to be simpler than tracking through a URL. So it can be that fast path to showing engagement. This is a vignette of another regional client that we had worked with, distributing out to Medicare and commercial households. We had, of course, this is a genericized version of it at the left, but basically a letter over the open enrollment period that was asking members to, again, get involved in a mail order pharmacy program. Now, one thing that can be really tough for all healthcare organizations is, you say in a meeting, hey, how do we get the data? it's almost like just punching the brakes in some cases of those data queues. The IT queues are so long. So what can you do? Well, if you are implementing QR codes, then a lot of your platform partners that distribute these materials should be able to say, we can also track the clicks under those QR codes. And then if you do have the data, we can close the loop and say who not only took the click, but then who actually took the action. And for those that took the click, but then they abandoned, we should analyze those people and understand who they are and what their barriers might be so that communication can be improved in the future. I like this technology because it brings the print asset right up into the exact same kind of insights and analytical world as what we do with email or what we do with SMS. I guarantee if your organizations have email marketing or email distribution platforms like a MailChimp, a Marketo, whatever that might be, there's no way that you would invest in those tools if they didn't bring you back what were our open rates on every subject line? What were the click-through rates when we included different buttons in those emails? We haven't always been able to do that with that huge footprint of print that's going out to members, but these QR codes allow us to get proxy metrics like that. So if we sort of toyed with a design or language like Melissa was talking about, where we wanted to use authority as a way to meet that member and really encourage them to take the action, we now have that sort of open rate, so to speak, on that print asset. And again, the value is we have it at huge volumes because we can send this out to everybody, not just that subset that we have an email list for. So great technology. I'm sure a lot of you are using it. I would just say press one step further to make sure that you're using it to also measure and manage, not just to make it convenient for your membership there.
That's great, Drew. It gets right back to you can't manage what you don't measure. So it helps bring print right back up with those digital channels for sure.